Good evening, folks. Today I want to talk a few minutes about trichomoniasis. Let's make it like a case. A 30-year-old female came to you. She's complaining like, "Doctor, I have some vaginal discharge and water for the last 1 week and it is itching." And she has a partner also, but partner is fine. He's asymptomatic. And you, after taking history, you did the examination. You did the speculum examination, and it showed strawberry cervix. And then you took a little bit of vaginal discharge and examined the discharge under the microscope, and you saw some microorganisms, some flagellated microorganisms among the WBC. So what is this? Basically, this is trichomoniasis, and this needs to be treated with metronidazole. And when you test a patient for trichomoniasis, you need to remember about other STDs too, because many of these STDs, they don't come by themselves. And also think about the partners. How is your partner? Does your partner have any symptoms? In the United States, there are like millions of people with trichomoniasis. I heard that there are more than like 7 to 8 million people with this problem. So, but the good news is it is decreasing because the people have more knowledge about trichomoniasis, and also thank God for metronidazole. People have this medication, it is available, and we are treating people with this medication. So let us see some basic points about trichomoniasis today. Basically, trichomoniasis is like a protozoal infection. It's a protozoal infection caused by Trichomonas vaginalis. And interestingly, 90% of men with trichomoniasis are asymptomatic. So 90% of men, even men can have this. That's an important thing to remember. Many times we say, oh, trichomoniasis is only a woman's problem. No, it's 90% of men who carry this are asymptomatic. So if a female partners, so like for example, like if you have a female patient and you need to ask about how is her boyfriend, you need to test him, because otherwise if he is an asymptomatic carrier, he will infect her again and again and again. So this infection is predominantly transmitted via sexual contact. Let us see some important information about the symptoms. Trichomonas is associated with vaginal discharge. Some women will complain, oh, I have itching, I have a little bit of pain sensation like that. So even in pregnancy, Trichomonas infection is associated with the low birth weight, associated with premature rupture of membranes, preterm delivery. Also in HIV, the patients are very prone to HIV because their vaginal or cervical tissues are damaged, a little bit of inflamed. Now they are at high risk to get HIV infection. And many studies done in Africa actually proved that people with trichomonas are at high risk for HIV. And trichomonas is associated with vaginal discharge. So you have to do a complete exam, a wet prep, an assay, a culture or pH examination. Those things need to be done. But to be honest with you, I don't do all those tests because I do nucleic acid amplification. I simply take a little bit of discharge and send it to the lab for nucleic acid amplification, because that test is like culture right at the nuclear level, and it gives you more information, like it gives you Trichomoniasis, Gardnerella, or Neisseria, chlamydia, many different vaginal infections. You will get these results like in couple days. So but in the olden days they used it to do this. Even now some people are doing it. That's good. There is nothing wrong with that. So the physical examination, you need to examine the external genitalia for any discharge. A speculum examination is done to determine the amount of discharge and the character of the character of the discharge, and also you look for that strawberry cervix. So they have a diffuse malodorous yellow discharge, and they have itching and irritation. And when you do the speculum examination, you will see a strawberry cervix. That's a clue. In the exams, that's a very good clue. Trichomoniasis, strawberry cervix. The mnemonic is try to eat strawberries. Try to eat strawberries. Trichomoniasis, strawberry cervix. So the patients, many times they say the discharge is bad. So you need to do the test like wet preps, and you take a cotton tipped applicator. If you want to do a wet prep, basically you take that discharge, you place the discharge in normal saline, not water. And then a drop of the suspension, you take that, you place that on a slide and you cover with a cover slip, and then you carefully examine it under low power and high dry objective lenses under the microscope. And you see these motile trichomonads, and they are very easy to visualize, and you see those flagella. And the vaginal pH is more than 4.5 usually. But there are other conditions like a menopause and bacterial vaginosis. You will see a pH more than 4.52. So the wet prep, it has 60 to 70% yield if you do it carefully. But there are other like kits these days, like OSOM Trichomonas rapid test kit. For example, if you use this kit, you take the vaginal secretion, and you can do that like a point of care test, and it gives you like 83% specificity and more than 97% specificity. So Trichomonas rapid test is available, and you can do that like within an hour you have the results. But the culture is still the most important in any test. In any infection, the most conclusive test is culture. You actually take the discharge and you culture it, and you will see what is the problem. Then let us see a little bit of differential diagnosis. The most important thing is bacterial vaginosis, clinically speaking. You will always have that question, is this bacterial vaginosis or trichomoniasis? So because the water, they both have same water. Unfortunately, clinically, you cannot make any distinction many times. Strawberry cervix is true, but how many times can you do the speculum examination and find it out? Ultimately, the microscopic examination gives you the distinction. In bacterial vaginosis, you will see the clue cells. That's an important point, folks. You will see clue cells in bacterial vaginosis. The mnemonic is, baby, don't be clueless. Baby, don't be clueless. Bacterial vaginosis, clue cells. And try to eat strawberries. In trichomoniasis, you see strawberry cervix. And the other thing is candida vaginitis. In candida vaginitis, you see cottage cheese-like discharge and vaginal itching. And many times the female patients will tell you it's a whitish discharge. Then it's more likely candidal infection. You need to think about other STDs these days, like because STDs are going up because of the sexual promiscuity increasing in our society. So you always think about chlamydia and gonorrhea and treat them. Now, treatment-wise, metronidazole 2 grams you can give as a single dose or 500 milligrams twice a day for 7 days. The other medication is tinidazole. Tinidazole is also indicated as a one-time dose of 2 grams. And it is actually, it's very good if you want to treat like a metronidazole resistant Trichomonas vaginalis. Tinidazole is a good medication. So, tinidazole and metronidazole. So, a nucleic acid amplification test for Neisseria and chlamydia should be performed in all patients with trichomoniasis. Pregnant women, treat them with 2 grams of metronidazole with a single dose. It's a category B medication. So, in pregnant women, always treated because they have high risk for premature rupture of membranes, preterm delivery, low birth weight, all these complications are happening. So always treat pregnant women with trichomoniasis to prevent those complications in pregnancy. Treatment of Trichomonas vaginalis might relieve the symptoms of vaginal discharge in pregnant women, and many times it prevents the genital infection of even the newborn babies. So the CDC is recommending the treatment in pregnancy. So I have the same recommendation. So today we have seen some basic points about trichomoniasis. If you have more points, feel free to add in the comment section. Thank you very much.